Hi guys, welcome to the Cation. Today, our topic of discussion is
Local anesthetics. Definition of local anesthetics. These are the drugs which, when applied topically or injected locally, block the nerve conduction and causes reversible loss of sensation in that part supplied by the nerve. Chemistry. Their weak bases consist of three parts: hydrophilic group, lipophilic aromatic group, and intermediate ester or amide group. Mechanism of action. Now, here comes the question how local anesthetics works. They basically block the neuronal conduction by acting on voltage sensitive sodium ion channels which are present in neuronal membrane. It is a transmembrane channel which has two gates. One is MEG gate or M gate towards outside the shell, and the other is Hurl gate or H gate towards inside the shell. Local anesthetics receptor are present in the inner side of this channel. When we apply local anesthetics, it goes and binds to this receptor in inactivated states, leads to block the sodium ion entry through the channel. It also increases threshold potential of the channel. Now let's dig up how this sequence of event occur. There are some points to be remembered that local anesthetics can penetrate or cross the axonal membrane and nerve sheath in ionized form in alkaline pH. When we apply local anesthetics, it enters into the body and some got ionized and some remain unionized. Unionized form in alkaline pH penetrate the nerve sheath to enter into exoplasm whose pH is lower than the outside, which favors local anesthetics ionization. Then the local anesthetics binds with its receptor in the sodium ion channels in inactivated state and increases its duration of inactivation. Thus, it increases the threshold potential of the membrane by blockage of entry of sodium ion into it. So, there is no depolarization of the membrane leads to failure of generation of action potential. Thus, nerve conduction block and finally results into local anesthesia. Factors affecting local anesthetics action. There are some factors which affects the action of local anesthetics, and the mnemonics is PAVLOD, where P stands for plasma protein binding, which is directly proportional to action of local anesthetics. It means more the plasma protein binding, more will be its duration of action. A for pKa. Higher is the pKa, lower is its action. Increase in pKa cause ionization of drug in physiological pH. V for presence of vasoconstriction which prolongs its action. L for lipid solubility. Increase in lipid solubility directly proportional to action of local anesthetics. Increase in lipid solubility helps the local anesthetics to penetrate the axonal membrane easily. R for rate of diffusion. If local anesthetics is diffusing faster, then its action will be immediate. Action of local anesthetics on different physiological system. On central nervous system. Most of local anesthetics can cross the blood-brain barrier and stimulate central nervous system initially, followed by its depression, which leads to tremor, excitement and confusion. They block the peripheral nerve fiber, leads to disappearance of following sensation. The sensation recedes by following manner. At first pain, then temperature, then touch, followed by pressure and motor function. They block autonomic nerve fibers earlier than the somatic. Action on cardiovascular system. Local anesthetics are known as cardiac depressant. It decreases contractility, conductivity, heart rate and excitability. Also prolong the effective refractive period and decreases abnormal pacemaker activity of heart. At high doses, it can cause cardiac arrhythmia. Generally, local anesthetics cause fall in blood pressure due to neuronal blockage, but at high dose, it relaxes arteriolar smooth muscle. Techniques of local anesthesia. There are various ways to use local anesthetics. Among them, few are as follows: surface anesthesia, infiltration anesthesia, conduction block anesthesia, spinal anesthesia, surface anesthesia. As the name suggests, it only anesthetizes the superficial layer, but no motor function is affected. It is achieved by use of local anesthetics topically on the abroaded skin and mucous membrane. Drug used: benzocaine, tetracaine, and lignocaine. Uses: to anesthetize mucous membrane of the eye, mouth, cornea, and upper respiratory tract. Infiltration anesthesia. In this type of local anesthesia, diluted solution is directly injected into the tissue to block the sensory nerve ending. Drug used: bupivacaine, procaine, lignocaine, and ropivacaine. Uses: it is used in minor surgeries such as suturing of wound, drainage of abscesses. Conduction block anesthesia. As the name suggests, there will be blockage of neuronal conduction. It is of two types: field block anesthesia and nerve block anesthesia. Field block anesthesia. In this type of local anesthesia, anesthetics are injected to a particular part of the body. The part distal to that part will be anesthetized. Uses: mainly used in operation of limbs. Nerve block anesthesia. Local anesthetics is injected near a nerve or nerve plexus to block its conduction. It covers a larger area. Most of the anesthetics are used to achieve this. Uses: it is used to block brachial plexus for upper limb surgery, intercostal nerve block for anterior abdominal wall surgery, cervical plexus for surgeries of neck, sciatic and femoral nerve block for surgeries in the area distal to the knee. Spinal anesthesia. It refers to the anesthesia of the spinal root by the application of local anesthetics directly into the subarachnoid space via injection. Site of the injection: space between L2-L3 or L3-L4 below the lower end of spinal cord. Drug used: bupivacaine, tetracaine, and lignocaine. Uses: for operation in the area below umbilical line, lower limb surgery, and caesarean section. Complication: hypotension, respiratory paralysis, septic meningitis, and post-operative urinary retention. Contraindication: it is contraindicated to use in young children, person having vertebral abnormalities, sepsis at lumbar puncture site. Intravenous regional anesthesia or Beer's block. It is achieved by injection of local anesthetics in a vein occluded by a tourniquet. Drug use: prilocaine and lignocaine. Uses: for upper limb surgery. We will discuss about the drugs used as local anesthetics in our next video.